Right. So I've got a very quick, short little presentation specifically on hormones and sexual health. And to be able to talk about hormones and sexual health, I need to teach you a couple of things about hormones. So obviously we're giving people hormone therapy, and hormones is quite a big part of sexual function. So we have to be able to understand how hormones affect sexual function, and that needs to be part of this informed consent discussion. And we don't really understand a lot about how hormones affect different people's sexual function, but we do know that it can change sexuality and it can change your client's erotic blueprint, which can be very alarming if it's not thoroughly counseled before. And each client will be affected very differently. So quite often we think of sexuality and sexual desire as there's one kind of way of how we are attracted to people, and either you have it or you don't have it. But actually, there's a wide range of ways in how we get physically attracted to people. And so what's actually happening, it's not so much that you lose your attraction, but that the way you feel attracted changes. And I think that's quite interesting in terms of how we relate. And so these conversations also very much need to involve partners. So I'm just going to, this is something that I teach quite a lot. I've got a whole section on teaching around what I'm calling testosterone-based sexual desire and oxytocin-based sensual attraction. So we know that you need certain hormones to feel sexual desire. So if you do not have testosterone, or if you've got low testosterone levels, you will most certainly have an issue with libido, and you will definitely have an issue with erections. The converse is not true, however. If you've got high levels of testosterone, it doesn't mean you necessarily have a high level of sex drive. It also depends on the receptors in your brain and on your sexual organs of how you react to testosterone. And that's where sexuality becomes fascinating. So you can't take a blood test on somebody and determine how their body experiences sexual desire. So testosterone and oxytocin is not the whole picture, but they're certainly part of the picture. And then the other part of the picture is just how how you've been wired, if I can put it this way. So some people have been wired to be very sensitive to testosterone in terms of attraction. And what I mean by this is, and this is the one we all know, right? This is the Netflix sex. So you see somebody and you think, oh, like that person. And when you're attracted to them, the experience that you have in your body is the experience of sexual desire. So we call that lust or feeling horny. With men, we will talk about getting an erection, for example. And when you get intimate, when you get under the covers, it's all about sexual arousal, and it's very orgasm orientated. It tends to be very visually stimulated. It's also quite individual, but testosterone, sexual desire general is more visual. So if you are horny, you would enjoy, for example, potentially watching porn. And if you've got testosterone desire, if you've got a lot of these testosterone receptors, you would have spontaneous sexual desire. So a good example might be our teenage boys. So you might often have experience sexual fantasies. You might have spontaneous erections for no reason. And masturbation would be quite common. And interestingly enough, testosterone is also linked to certain emotions. So we know testosterone is also linked to achievement emotions and aggression. And there's a whole package around when we talk about this type of sexual desire. So the world we live in today, just like we've said that, being heterosexual and cisgender is the only way to be, we've also said that everybody should be allosexual, which is this testosterone-based sexual desire. This is the way you are supposed to be attracted to human beings. But there are also human beings that are attracted in a different way. So a lot of people have a mixture, but I'm first going to show you the two extremes. So some people, when they feel attracted to somebody, this is what they experience. But other people actually, when they're attracted to somebody, they have an oxytocin-based sensual attraction. So again, they're attracted to somebody that they like for whatever reason. And this sensual attraction is not lust. It's not desire. So it's seeing someone, and the terms I've been using for it is when you're crushing on somebody, right? When you got that guy, when the knees go weak and the eyes sparkle. And again, we could potentially use some teenage girls here as an example, being slightly obsessed with another person. And very important is to understand that experience, that feeling that we would call romantic attraction, is actually a physical experience. It's physical attraction, and it can be as powerful as sexual desire. So a good example is I always give is the boy bands, and you've got all the teenage girls in the front screaming their heads off. Those girls are not horny. even though the boy band thinks that they're horny, most of them are actually in this oxytocin state of being obsessed and crushing on these boys. But the sexual erogenous zones might actually be completely quiet. So when they get under the covers, so this is hand holding and playing with hair and chatting and kissing, that sensual arousal is all about enjoying the kiss. It's the melting kind of fainting thing that happens. And again, not related to sexual arousal at all. It's interesting that it tends to be less visual, so it's more linked to connection. And some people with oxytocin-based sensual attraction might not have any spontaneous sexual desire at all. So they never have sexual fantasies. They never think about sex. They don't like watching sex. They've got no desire for masturbation. It just doesn't come up. And they might, but that doesn't mean they don't not able to have sexual desire. But the sexual desire only comes in very specific, safe contexts. So, for example, it might be somebody in a relationship who lots of kissing and touching and cuddling, and trust slowly builds up, and out of that suddenly sexual desire becomes possible, and now we're actually able to have great sex. And of course, when you combine these two, then I think that's what you would call making love, right? When you've got the oxytocin and the testosterone in the mix. And oxytocin is very much linked to attachment emotions. So these are both valid ways of being attracted to each other. And again, the DSM irritates us all because it has this whole thing of if you don't feel spontaneous sexual desire, then they categorize you as what hyposexual desire disorder or whatever. Complete and utter nonsense. There are a lot of people who do not have any sexual desire, and that is completely normal. So when we talk about intimacy levels, therefore, there are levels of sexual desire as a form of attraction. So these are these people who are testosterone sensitive. And again, not to do with your level of testosterone, got to do with how you respond to testosterone. And so an allosexual would be a person who experiences sexual attractions to others when they see somebody else. We also have the term asexual or ace. So there are people who do not experience sexual attraction to others at all. So that's just not what they feel. When they see somebody else, they'll crush on people, they'll strong physical attraction, but it's not sexual. And demisexual is actually, it's a lovely term. I think there's quite a lot of people who are demisexual and not aware of the term. But this is somebody who has to have an emotional attraction to somebody, has to be in a relationship, has to be bonded to somebody before sexual desire would come at all. So, and similarly, then we talk of romantic attraction. The word's not ideal because people quite often think it's an emotional thing, but we're talking about it here as a physical attraction that's oxytocin sensitive. So an alloromantic is somebody who experiences romantic attraction to others, and you can be somebody who's allosexual and alloromantic. So these are not exclusive at all. But you get some people who are aromantic, so more so in those assigned male at birth, but also not exclusively, who might mainly feel sexual attraction and not so much get the whole the whole fluffy romantic stuff. And then so some people actually would identify as aro-ace, meaning they're aromantic and asexual, and they do not experience physical attraction to other people, but they might have emotional reaction and have emotional relationships, but have no desire to enter into any physical interactions. And again, demi-romantic, that's typically those guys in the movie, who in the movies who has all the one-night stands and don't remember any of the partners' names, and then be a guy or a girl, and then eventually they meet the one. And then suddenly they are able to become emotionally, romantically attracted to somebody that they get emotionally attached to. These are, so when we now start giving people hormones, what we are doing is we are shifting them potentially. And interestingly enough, it's not the same for everybody. So if you're giving somebody estrogen, then we're obviously reducing their testosterone dramatically, and it can definitely reduce those spontaneous sexual desire. So they might not have erections every morning anymore. They might not have that spontaneous sexual desire. For some trans women, this is great. Some trans women find erections dysphoric, but some trans women enjoy their erections. There's no right or wrong, and this could feel like a little bit of a loss. And there can be this fear that, oh my goodness, am I not going to be able to have sex anymore? Why am I no longer experiencing sexual desire? What does happen is that the intimacy preferences change. So quite often as that sexual libido goes down, we see much more of this oxytocin-driven sensual attraction become more predominant. The sexual desire is still there. And so it's to say to somebody, that's absolutely fine. Just do the cuddling and the kissing. And what you will find is that sexual desire will still come. It's not that the testosterone it's not that you're no longer able to have sexual desire. It's just that this is the way that they present is different. It's extremely important that partners get involved in these kinds of conversations. So you can imagine as partners, we all get into a little bit of a rhythm of how the dynamic works and who likes what and how we play. And now if the one person's intimacy preferences change, that can confuse the other person terribly. So this for me is a very important part of the conversation. Masculinizing hormone therapy tends to cause less stress because, we live in a world where everybody thinks having a lot of libido is a great idea. And again, not everybody, but some of the trans boys will notice an increase in libido and arousal. And that might be new for some of them who's never had a spontaneous sexual desire before. And again, the partners need to be involved in this conversation to be able to understand what all this means. So we obviously can manage these sexual consequences. I find with the majority of patients, it simply has to do with actually just discussing why the changes are there. And most people just learn how to play differently. It's not that you lose something, it's just you change one thing to another thing. But of course, it is possible for trans women who are very connected to their erections. One can use your phosphodiesterase type inhibitors, and then for your masculinizing hormones, remember to talk about clitoral enlargement. That's one of the testosterone effects, and can also be linked to more of that spontaneous desire. And then for vaginal atrophy, we can use lubricants and topical estrogen for those that are still having internal sex. Thank you. That was a very nice, quick presentation on hormones. And you're very welcome to put questions about that in the chat. I know some of those might be quite new concepts, and we are perfectly on time, which makes me happy. Just checking if there's any questions. Thank you for everybody who's introducing themselves. Lovely. Okay. So let me get my next presentation up. This is 10 minutes on the surgical gender affirming healthcare. And then at that point, we're going to have a break and break out into our breakout rooms. And then I'll just opening my presentation.
Madeleine, there is a question in the chat.
Okay, I
can read it to you. Is the sapiosexual identity linked to the hormones?
So, yeah, so, okay. So there's you have gender identity, which is how you feel about yourself. Then there's sexual orientation, which is who and what you are attracted to. And then there's types of attraction. So I've mentioned 2 types of attraction, which is literally this attraction via this testosterone versus oxytocin. But there's lots of other types of attraction. So the one attraction is emotional attraction, and we have that in friendships as well, when you've got an emotional bond with someone. Sapiosexual is very much to do with being attracted to somebody's intelligence. And having it. So you might sometimes have, and there's lots of combinations. So that's a description, and I would say it's separate from your hormonal attraction. So for example, you might have somebody who's arrow ace. So those are people who might more often talk about those kinds of terms in terms of trying to describe other kinds of attraction. And they might say, I'm arrow ace, I don't have any, I'm asexual, I'm aromantic, but my way of feeling attracted to other people is through their intelligence. But it's also possible that you might be somebody that's asexual, but you're alloromantic. So you do have romantic attraction to somebody. So you do have that oxytocin type of attraction, but also your attraction is very strongly not so much based, it's very much based on this intellectual, being attracted to the intellectual part of the human beings. So they almost fall for me in slightly, and same with emotional attraction. You can have both sexual attraction and emotional attraction to somebody. You also get aesthetic attraction, where you're just attracted to somebody because they're gorgeous. So you might be arrow ace and we're hanging out because we are gorgeous and we're hanging out together. So these are all just descriptions. And I think the challenge of the world we live in is that we all get fed with there's only one way to be. You have to be heterosexual, you have to be cisgendered, you have to be allosexual and alloromantic, and that is the way that everybody works. And what actually happens in practice is that there's an extraordinary amount of diversity, because that's just the way nature works. And within that diversity, people are trying to find all these different labels because it helps us just to try and break this idea that there's only one way to be. And eventually these labels will hopefully start falling away, and it'll be like hair color. So some people are blonde and some people are brown haired and some people are red headed, and there's just a lot of variety. And what you want to do is be able to explain and describe to somebody else who you are and who you are as a person, who you are attracted to, and how you like to play. So thank you. Lovely, lovely question. I can talk about these things for a long time. Okay, let me get my next presentation up. So I'm definitely not an expert on this. These slides are from Dr. Kevin Adams. He's a plastic surgeon who's been for many years been doing gender affirming surgery in Groote Schuur.